Welcome back to Healthcare Rounds. I'm John Marchica, CEO of Darwin Research Group. Today, I'm speaking with Dr. Geeta Nayyar, who I will be calling Dr. G, author of Dead Wrong, Diagnosing and Treating Healthcare's Misinformation Illness. And so today we're going to be talking about a topic that is really near and dear to my heart and probably has been for 25 plus years. So welcome, Dr. G. Thanks for coming on.
Thank you so much for having me, John. And like I said, my daughter says Dr. G makes me sound a lot cooler than I actually am. So I gotta, put that spoiler in there.
Well, it does sound cool. It sounds cool and hip. And hopefully there will be some people that think this is a cool and hip topic. I think it's an important one. So let's just dive right into it. You said that misinformation is the issue of our generation, and even going as far as to suggest that misinformation is an illness in healthcare itself. So talk a little bit about what sparked your passion in this issue, why you got interested in it, and certainly why you're so passionate about it now.
Sure, you bet. So, I'm a rheumatologist by training. I still see patients just a little bit at the University of Miami. And so the reason I really wrote this book was just my everyday life as a doc, and really very reminiscent in March 2020 when COVID was really, full effect and things were closing and just all the things we all remember. It really brought me back to a time during the HIV/AIDS crisis when I was a young doc in the district training at GW. And it was the same story, John. It was the same story of mis and disinformation, the stakes being incredibly high. At that time, I had a patient, actually the book starts off with this, a patient named Jerome, who was one of my first patients to ever die on me. And I rounded on him every day for 6 weeks. And every day he told me what a terrible, terrible doctor I was and that he was not a homosexual. He did not have AIDS. And I clearly did not know what I was doing. And then circa 2020, I'm seeing patients in Little Haiti at and I'm being asked questions around, everything about the virus, to then when we actually had a vaccine, everything to, are you tracking me and how much do you make every time I get vaccinated? So you can imagine that I felt the cycle needed to end. And I think in healthcare, for all of us in the healthcare system, we appreciate that mis and disinformation is part of the ecosystem, but we've never really recognized it or made it our mission to solve. And so that's really what inspired the book, is to say enough's enough. Let's define the problem, let's outline the problem, but then let me give you all the reasons that I think we need to work on it and some of my guesses at the solution.
So what is the difference between misinformation and disinformation? And why does that distinction matter?
Sure. So first of all, thank you for the question, because a lot of people don't know that. So misinformation is you missed it. You just got the facts wrong, kind of like a rumor, right? So-and-so said this thing, and then you have a role to play, John, believe it or not, when you pass on that information and you have no idea if it's actually factually correct, right? Just like a rumor, right? Anyone spreading that rumor is just as involved and just as responsible. Now, disinformation is actually more dangerous, because disinformation is actually the intentional spread of disinformation to sway the masses for some kind of ulterior motive, whether it's financial, political, because you're trying to build your business online and you want subscribers, et cetera, et cetera. But disinformation is actually meant to intentionally harm folks with the wrong information.
Where do you put people that, all right, I'm going to go there. Because we're going to talk about vaccines.
Mm-hmm.
Where do you put people who maybe in their hearts believe that something is true when in fact it isn't, rather than the more kind of gross, I'll use that word, intentionally misforming people? And I'm thinking about, some of the things that are coming out of the new administration around vaccines and vaccine, being dangerous and defunding mRNA and all this kind of stuff. How does that? What about that group of people that they're just misinformed but have a big podium?
So First of all, I don't think anyone wakes up in the morning with the intention of, let me play the fool today, right? So the everyday consumer, in other words, I don't think anyone's waking up saying, yeah, I want to be fooled and I want to, be sold something. I mean, that's just not anyone's experience, right? And in today's world, unfortunately, because healthcare does not do a good job of informing the masses or inspiring the masses or being accessible, we are now competing with the Dr. TikToks of the world, which just make it so accessible and so inspiring. And whether the facts are right or not is kind of a nominal thing because they've got you and know everything about you and they suck you into the rabbit hole of social media, right? And now you add on AI and these rabbit holes become even harder. You don't even realize that you're in an algorithm, right? And all you're
Right.
seeing and all that everything coming at you is clearly what you interpret to be the facts. So I think, first of all, a lot of empathy for folks who are in rabbit holes and don't even appreciate that they are, because it is so easy to get lost in today's system. And when you don't have a physician or a nurse or a pharmacist partnering with you because of access, insurance, all the reasons and your audience knows, I think it's really easy to get duped. Right. And desperate times call for desperate measures. And so, and often with mis and disinformation, because of fear, because science sounds so complicated, people turn to an alternative, which just sounds easier, just seems a lot easier and a lot more comforting than actual reality, if that makes sense. So there's that piece, the consumer piece, right? And these are victims, let's be honest, right? These are actually victims. And I'm not someone who blames the victim, right? It's a matter of how do we improve health literacy and just all the things and improve healthcare so people are not looking for alternatives. Second, as far as mass disinformation and the perpetrators of mass mis and disinformation, look, we as a society, we as an enterprise in healthcare have to start realizing that these are entertainers, right? No different than a rock star, no different than a movie star. And if that's where you go for your health information, that's the biggest question. And that's the biggest thing we can help consumers with, is to say, look, all of us love entertainment. I'm not going to lie to you, John. There are some reality shows out there that I really enjoy when I want to turn my mind off.
Sure.
Now, I
Me
realize,
too.
yeah, right? I mean, there's some good ones out there. Now, I realize that it's entertainment, and I'm watching it for the entertainment and to turn my mind off. I am certainly not watching it for information about my health, about education, about anything that sort of is of substance, right? What's happened in today's world, though, is it's so hard to tell the difference between entertainment and substance. And that's where I think we really do have to improve health literacy. And we need enterprises like hospitals, payers, life science companies, medtech companies. We need everyone's help to help with the science, those that know the science, right? Because so much of mis and disinformation, one of my favorite quotes from the book is, mis and disinformation grows in the dark. When healthcare doesn't do a good job of communicating science and the facts, simply inspiring all the things, well, that's why these folks have been so successful, because there's not anyone out there making it hard for them. We've made it so easy for them. And now our job is actually harder. And now we're seeing that mis and disinformation contributes to physician burnout. We're seeing that enterprises, whether it's provider systems, payers, life science, medtech companies, they all talk about consumer experience and their strategies around consumer experience, value-based care. Well, let me tell you something. If you care about consumer experience, value-based care, if you don't know what a mammogram is, you are not getting one. And if you can't get an appointment for 6 or 9 months, someone to actually write the order for the mammogram, and someone is offering you a home genetic kit on Dr. TikTok's page for just $9.99, click here. That's a pretty good option, right? So I think these entertainers have been wildly successful. I think they will continue to be wildly successful, but largely their success is because of our absence. And I'll give you a small example. I talk to all kinds of groups, but one of the groups I talk to are hospitals and hospital associations. And, what is one of the first things they do when they find out that their handful of doctors on their staff are amazing influencers? The first thing they do is reach out to those doctors and remind them that whatever they say is not associated with the hospital. They cannot mention their affiliation. There has to be a disclaimer, right? I mean, this is a great example. Like, we are so afraid we can't even get out of our own way, right? Because what you should be doing if you're an enterprise is say, man, we've got some natural talent on our staff. We've actually already hired them They are licensed. They have met all the privilege requirements for the hospital. You, in fact, need to give them a gold star. You then need to get them to help inspire and teach the rest of the staff. You also have to pay them for their time, because that's the kicker, right? This is not a volunteer service. Docs can't take on one more thing. So there are any number of ways that perpetrators of disinformation have been successful. But my call to action, very much the spirit of the book, is it's kind of because we stayed quiet. It's kind of because we don't even make it easy today. After all of the information out there, we've not even made it easy today to help those that are actually the experts get their voice out. So people pretending to be the expert have a carte blanche and they don't have a license. There's no accountability. If somebody gets hurt, they're not going off the air, John. They're not losing business, right? Whereas docs can lose their license, lose their reputation, right? Can impact so many different things. There's an accountability. And so I think these are the things: entertainment versus experts. That's what it all comes down to, and the silence of the healthcare leadership.
Well, I want to get a little deeper on that entertainment versus experts just a little bit, because this even goes beyond healthcare. And I finally last week I started getting around to reading Tom Nichols' book, The Death of Expertise, which has been around a while, sitting on my shelf. But there is entertainment and there are experts. My concern is, what about distrust of expertise? And, the fact that there is a contingency of folks out there that, and we'll go back to the vaccines. One of my favorite examples, because I've been talking about this for years. The guy fakes a study, he loses his license. They retract the paper from British Medical Journal or Lancet or whichever one it was in, saying that vaccines cause autism. That's the start of a lot of this nonsense 20 plus years ago. And here we are debating the expertise around vaccines. Now, I'm not an MD, but I've read enough of the peer-reviewed literature and understand how, it's pretty settled. It's relatively settled science with like multiple meta-analyses of data over the years. And yet there is this distrust among some folks of expertise. Where does that come from? And
Sure.
how do you combat that as a physician or somebody like me? How do you combat that?
Sure. So undeniably settled science, right? When we look at the communities, particularly the autism community, right? Everyone wants someone to blame. Again, when we talk about misinformation, a big part of why and when it surges is during times of confusion, scary times, right? Pandemic was also another great example. HIV/AIDS is a great example, right? So times of crisis. I don't know if you have children. I do. It's easier to blame someone, right, John, than to get a scientific answer. So that's one. And I think you have to have compassion and empathy for those individual families and cases, right? And if that's the one stronghold you have, is that one study, that one thing, maybe my child is the outlier, right? It sounds it sounds better than this bad, really terrible, bad thing just happened, and I don't have an explanation for it. Right. And so I think we have to lean into people are people. And this, we deal with the business of humanity, that is healthcare. And then so that's at the individual level. But if we zoom out, why don't people trust the healthcare system? John, have you been to an ER anytime recently? Have you been to a hospital anytime recently? It's never a good experience. It is disorganized. Try and ask them for your bill. Ask them what exactly you're paying for. Look, the simple financials of insurance and not having insurance and where you go. It's so confusing, even for those of us who are in the healthcare industry. Imagine if you are not, right? Look, when we look at the underserved communities, the Black and brown communities, Tuskegee is the thing. Tuskegee is a very real thing. And there are really good reasons why people don't trust the healthcare system. And therefore, expertise goes along with that. And I examine a good amount of this in my book with a particular emphasis on the underserved. And when you read that and you read the history of why these communities don't trust the healthcare system, believe me, you would feel the same way. You would feel absolutely the same way. I mean, there is a family that we spoke with for the book. And man, the maternal head of the household did every abortion in that household because at the kitchen sink, because they had had such mistrust of the healthcare system. They literally groomed someone in the family to take care of the women in the family. I mean, that's not just distrust, but passionate distrust. Right. And so if we look back on these things, there's an ownership that has to happen, an acknowledgement, but then just transparency. And then you add all the terrible things that happened during COVID, all of the ways communication was either mishandled or not handled appropriately. It's just never been our strong suit in healthcare. And so I think when we basically fundamentally think about communication, we're not good at that. John, I mean, I get a postcard from my doc once a year that says, "Dear Miss," they don't know I'm married, they don't know I'm a doctor, "Greta," who is an Eastern European cousin, maybe, I don't know who she is, maybe, "happy birthday. It's time for your mammogram." Do you think I trust the person who sent this postcard? I know they don't know me. That's what that postcard tells me. I know they don't know me. I happen to think a mammogram's a good idea and I'm going to go get one, but not because of that postcard, right? Nothing about that postcard. So, and now you enter social media, AI, all of these things, and they're like, "Hey, Dr. G, we know that you love science. Let us tell you about the latest technologies in mammograms." And they know how to talk to me, right? And here's the incidence in South Asian women that are, mid 40. Like they know exactly who I am. And then they say, "Here's this supplement that you can add to your mammogram this year." And it's just $9.99, John. So
Well, that's not the snake oil is not new, right? I mean,
it's
that's been
not new.
around.
That's right.
And as you pointed out, going back to uh, Trojan War and Spanish flu and all these other things, there's, to your point, when there is discord or stress or things like a pandemic, then that's when these things can happen. I worry about, how do we get out of this cycle? How do we get out of a cycle that appears to be, throw AI on top of it, right?
Right.
And so
It'll fix everything.
yeah, or make things a heck of a lot worse.
That's right.
Right.
Yeah.
So, I'm not. I know we're not at the point where we're getting to conclusions, but what are some of the things? What are some of the things that you can recommend? And I'm going to say not to the consumer, but let's assume that there are healthcare leaders that are listening to this podcast.
You bet.
What are some of the things that you could? We'll start with the health system, idea, whatever, the hospitals, the organized health system world. What can we tell the leaders who might be listening to this to make a difference? How can they start making a difference?
Sure. Well, first of all, I appreciate the question. And it starts with this. It starts with an acknowledgement that this is happening in our communities. It starts with a conversation around it, right? And you can start with your pediatricians, as you mentioned, asking the question of, how is mis and disinformation affecting your communities and your staff? And so I'll give you a quick example. In communities, if you had been doing an analysis of the things happening on social media, if you were putting together a mis and disinformation strategy, in other words, as an enterprise, right? Number one, it starts with listening. And then looking at the analytics. It's all public, John. This is all public information, right? You could have predicted several measles outbreaks by the chatters and conversations happening in specific communities. So if you were a system in those communities in Texas, et cetera, you could have known that was coming. And then you could have launched said campaigns, said community outreach, both for prevention, as well as, even if you weren't in it to do that, getting your staff ready, making sure your staff was vaccinated, making sure your staff was up to date on their vaccinations, right? All of these types of things. And then also making sure your staff was ready to have the conversation around, this is why we get vaccinated for measles, for example, right? Two, when we look at physician burnout, which still remains one of the number one issues for every hospital system, when you talk to doctors, let me tell you what started with my conversation around Jerome. Do you think I felt good every day hustling for this patient who told me what a terrible doctor I was every day for 6 weeks? It didn't feel good. It wasn't motivating. It wasn't inspiring. If I was tired, I was more tired after that conversation, right? If I was disenfranchised, I was more disenfranchised after that conversation. So what we know about mis and disinformation now is it is a big contributor to burnout. Very different from the patient who says, "Thank you, Dr. G. Thank you so much for your time. Thank you so much for being here. And I know you have lots of things going on, et cetera, et cetera." So if you're interested in physician burnout, this is also important to address and understand and hear from your docs and your nurses. Is this something that they're dealing with? And I can certainly tell you in pediatric departments, especially with back to school, this is something every pediatrician has to deal with. What have you done to help your staff have this conversation? And what resources do you provide to patients? Because, 8 minutes once in 6 months is not enough time. So what are the resources that the enterprise has that says, look, if you have more questions, here's subscribe to our channel as opposed to their channel, right? Don't subscribe to Dr. TikTok's channel. We have a channel that our doctors are actually on. If you like what they said or have a question, you can make an appointment, i.e. we are accountable, right? And then lastly, this is really about marketing and technology. I actually do a LinkedIn Live with Casey Kalpin, Chief Marketing Officer of Premier, and we call it CMO squared, which is when the Chief Marketing Officer and Chief Medical Officer work together. Because this is one of those areas where, we always think in healthcare that marketing is just cute, a nice to have, not something critical to the hospital's success, right? Patients, the ER is always full. But truly, this is about a C-suite and primarily marketing and clinical working together across the enterprise and hopefully with IT as well, right? CIO, CTO, it's a team sport. But there's so many channels now. And so how do you, from an omni-channel approach, actually help patients who you want to get that mammogram? You are incentivized to get them to get the mammogram. But if they don't know what it is, and they don't know that your doctors recommend it because their trust is with the doctors, then they're not going to get one. And so understanding how your enterprise actually does this, and it's really interesting because when I do speak around the country and I ask how many people have a value-based care strategy or a consumer experience strategy or patient centricity, which is all the rage and has been, none of them talk about mis and disinformation because they all raise their hands when I say who's doing value-based care, who's got a strategy for that, who's doing consumer experience. Everyone raises their hand. But when I ask who's in charge of mis and disinformation, not one person raises their hand. And that to me is a total miss. Because how could you possibly be doing value-based care without recognizing this is one of the contributors, right? And then how could you possibly be doing consumer experience when you're not acknowledging this competition now that you have with Dr. TikTok? Because it's not just the doctor down the street and the hospital down the street anymore. You have a completely new competitor that is actually trying to get the consumer to not trust the hospital and the doctor, to altogether cut you out, right? And they're doing it pretty well. They're doing a pretty good job at it.
And that's their own sort of profit motivation, right?
Absolutely.
Or their own celebrity. What can we do to boost our own celebrity? And if I'm in this lane, this is the way that this is the way yeah. And so that's an interesting way to look at it. I wonder about we're a little bit off topic here, but you mentioned trust and talking about communications and all of that. Pharma, trust in pharma has been pretty low for a long time. And I thought that it would have gotten a little bit of bump from the vaccines and being able to respond so quickly in a crisis. What do you think that industry in particular can do maybe to improve health literacy or to combat this issue of mis and disinformation, or like umbrella, improve their trust versus where they kind of sit right now?
Sure. The more any of the stakeholders in healthcare can maximize the doctor-patient relationship, that is the key to trust. Because when you talk to consumers, the one person they still trust when it comes to their healthcare is their doctor. 93% of all consumers say to this day in a post-pandemic world that they still trust their doctor. And when you ask them who they trust when it comes to the healthcare system or what their interpretation of the healthcare system is, that number falls to 53% in terms of their impression of quality, right? i.e., the consumer in a post-pandemic world understands that the healthcare system, of which pharma is a part of, is not set up for their success. It is, in fact, not set up even for the doctor's success. But they see the doctor, and I say doctor, but I also mean nurse, right? The whole care team.
Yeah, I got it.
They see the doctor and the nurse, though, as the quarterback, getting through the dysfunctional healthcare system to get them that prior auth, to get them that medication cleared by their insurance, to get them that surgery, not in 9 months, but 6, right? And so for pharma, what I would say is the more they can partner with the KOLs, because the consumers will not trust a company, a corporation, but they will trust their doctor, right? So the more campaigns, the more partnerships that are done with everyday physicians, everyday nurses, along with continued knowledge, education, getting those celebrities out there, that's always, always very effective. I think it's really that dual partnership of the big megaphone that pharma is able to have and the celebrities they are able to enlist in the battle. But at the real community, everyday level, we know that still happens between the docs and the patients. And so to the extent they are really arming them for a lot of these conversations, whether it's vaccines, whether it's medications, whether it's just science, and why, like the number one thing patients say today is when they come in, they say, well, doc, I did my own research. This is now the leading conversation I have with patients is I did my own research. I mean, that's like me going to my accountant and saying, I did my own research. I don't think I should pay taxes this year. Right? Like,
It
of
drives
course,
me
you do your
insane.
own research, but the whole reason you do see me is because I go the next distance of that research, right? This is what I live in. This is what I do every day. This is my experience, right? And so the health literacy conversation is that basic of what is a doctor? What is an MD? What is a pharmacist? I mean, it can get very, very, we're at a point where the basics are very important and they're getting confused, right? And what is a chiropractor? What is a dentist? I mean, there are just basic things people, if somehow we've lost just the basics here.
Well, you're doing something right because at least in my prep for our conversation today, your book hit a number of different bestseller lists, and so I'm wondering because that's one way to communicate, right? It's one way to fight the misinformation and disinformation is to write a book about it and promote the heck out of it. What are you in since it's been out? It's been out a little while now. What do you think is resonating with the consumer? Not so much the leader that we've been talking about, but what message have you heard is resonating from the book that they say, yeah, well, now this makes sense?
Sure. Well, first of all, thank you for that. I appreciate that. New edition is coming out very, very soon. So I'll ask you guys to help me with that. Look, I think that the thing the consumer is appreciating the most, and from having looked at reviews, is the acknowledgement. Is first of all, just the acknowledgement that this is happening, why it's happening. Cause that was the first question you asked me. It's like, why are people doing this? Why has this happened? And also I think the shared experience, so much of the book is stories, right? And the shared experience of maybe I did get duped at one point in my patient journey, right? And maybe I need to re-examine that. But I think that it is a confusing time to be a consumer or a patient in healthcare. And that may have perhaps been the biggest piece is that there's a reason people are getting it wrong. And it's not because they want to be duped. It's not because they're not intelligent. And it's not because they don't have insurance necessarily, right? Like it's not just one demographic. This is across socioeconomic status. And so I think it's also, I think, been a part of the conversation around social media, right? We've learned so much about social media, the good, the bad, and the ugly over the years, particularly around mental health and our young people. And so I think this is adding more to that conversation of, yeah, maybe I shouldn't be on social media so much. This may not be the right source for me. And then expand that to podcast A, B, and C. And like we started the conversation, maybe that reality show is not the best place for me to decide what vaccine I'm going to get, right? Great entertainment, great podcast, but maybe that podcaster is not the person I should be going to for this kind of thing.
Yeah, well, certainly the situation is not going to get any better anytime soon. Dr. G, We could keep. I'll talk about this stuff for another hour or two, but people will be turning the dial on their or whatever on their iPhones, and say they'll be doing something else if we talk that long. So I want to get into some rapid fire lightning round questions, and then we can wrap it up.
Sounds
so
fun.
You ready?
Yeah, I'm ready. Bring on
All right, here we go. In one word, what's the most urgent tool to counter misinformation?
AI. You can fact check everything. You can use these technologies for good or evil, right? They're just as powerful if you're smart about it.
Absolutely. It's very true. A book you'd recommend to anyone facing information overload in healthcare?
Oh my gosh. I mean, my book, Dead Wrong. I mean, I got to say it. Do I get to say that? Does that count?
You get to say it. Yes. Speaking of marketing, you get to say it. Best short phrase to communicate why trusting healthcare experts matters now.
Oh gosh. I mean, it matters more than ever now. More than ever now, because Dr. TikTok didn't go to medical school. Maybe that's the phrase, because Dr. TikTok didn't actually go to medical school.
I love that. Technology you're most optimistic about in battling misinformation?
AI. Good and bad. There's good and bad. It's all in the application, of it.
And then one actionable tip for each of us to be better information defenders.
Look, first of all, do not spread the rumor, John. If you do not know if something is correct, do not send it to everyone in WhatsApp. Do not send it to your family. Do not talk about it at Thanksgiving, right? If you yourself are unsure of the source, do not pass it on. That is perhaps the number one thing every one of us can do, right? Number two, the basics. Check the source. Is the source legit? And what is the motivation of the source? Are they a patient advocacy group that's all in it for patients? Are they an entertainer that's in it for the subscription? Are they a politician looking for your vote? You must understand the source. And then secondly, is this collectively what the medical community thinks, or is this an outlier? Right? So is this one voice off the bell curve, or is this the bell curve? And this is settled science, and this is safe. And then lastly, making a doctor's appointment. Having a doctor that you actually know, that actually knows you, because we are all different, right? My kidney function might be different from your kidney function. My family history is certainly different from your family history. So this is where having an actual physician in your corner to say, this is generally public health advice, but for you, John, given X, Y, and Z, I'm actually going to recommend this. Period. Because at the end of the day, that's why you have an accountant, a lawyer. We all have personal situations. You need a personalized health plan.
Excellent. That was supposed to be lightning on that last one, but you were summarizing so well that I wanted to let you go with it.
So lightning, thunderstorm.
Thanks so much, Dr. G. How can people get a hold of you if they want to reach you or want to learn more?
Thank you, John. I appreciate that. I think I'm on everything but TikTok. So LinkedIn, Instagram, all the things. And then my website, drgeetanayar.com. And the book is available on Amazon, Barnes & Nobles, anywhere books are sold. So thank you for that.
Great. Well, thanks again. And that'll do it for another episode of Healthcare Rounds. Our guest today has been Dr. Geeta Nayyar. Also, we will say Dr. G. As always, I'm your host, John Marchica, CEO of Darwin Research Group. Do us a favor and leave us a rating on Apple, Spotify, or wherever you listen to the show. And if you haven't already, please follow us on LinkedIn and YouTube. See you next round.